Welcome to the Concussion Fix Podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms. Each episode, you'll hear real, live Q&A sessions with real members of the Concussion Fix program, an online recovery program that's helped more than 3,000 people find relief from their persistent concussion symptoms. Guided by our expert team, Dr. Paul Hrkal, Melinda Krynen Hill, and myself, Dr. Cameron Marshall, who are here to share insights, empathy, and a clear path forward. In order to protect the privacy of our members, we have stripped away names and blurred faces. Please remember all information shared is for educational purposes only and should not replace medical advice. If you need extra support and guidance for your recovery, we encourage you to check out the Concussion Fix program by visiting concussiondoc.io or Google Concussion Fix and read some reviews to see if it's right for you. Whether you're looking for answers, hope, or just a little encouragement, we're here for you. You're not alone. Recovery is possible, and it starts right here.
And are you familiar with the FODMAP diet?
I am, yes.
Because I'm following that diet and I was wondering how to combine it or if I should combine it with the Concussion Fix diet.
Yeah, so the FODMAP diet, just for everyone that doesn't know or never hasn't heard of that type of diet before, it's a specific diet that's avoiding what are called fermentable oligosaccharides. That's what the FO stands for. And those particular types of sugars, that's what saccharides are, can be fermented by the microbiome, bacteria in our gut, that sometimes is imbalanced or dysbiotic. It's a very common diet for people that are experiencing things like IBS, irritable bowel syndrome. So you can absolutely combine that type of diet, because what the FODMAP diet really is just a list of foods that are high in these fermentable oligosaccharides, and you want to avoid or minimize those foods as much as possible. And there's lots of resources online that rank the different types of foods from the highest for these fermentable oligosaccharides down to the lowest, and a person's trying to eat as much from the low category as possible. So you can just basically cross-reference that lowest category with the recommendations that we're making in the Concussion Fix, a diet. We are very specific when we created this diet that we didn't want to give people almost something that's very rigid and prescriptive, like you have to eat 1,800 calories a day and you have to eat 1 cup of blueberries, and so we've given some general recommendations. It's meant to be more of a roadmap than an actual step-by-step, minute-by-minute guide. Once you understand the concepts, you can apply it to any sort of diet. So if it happens to be FODMAP's diet, then absolutely you can implement both of them at the same time. Now, it might be a little bit more restrictive because you're avoiding some of those foods that are on that high FODMAP list, but it's absolutely doable.
Okay, thank you. Yeah, that was kind of what I was thinking, that it's kind of getting a lot to not eat.
It's a bit more restrictive. There's no doubt it's going to be a little bit more restrictive for you, but I think it's doable. And we've had a number of other members go through the program with other types of diets and still be successful.
Okay, that's great. Thanks. And for when I'm at the stage to reintroduce food, I was wondering how I should do that in a good way, because I noticed that my body kind of needs some time to get used to things. So when do I know that I really cannot have it, and when is it just like an adjustment period?
Yeah, really, really good question. I'm sure everyone's thinking the same thing about whenever you pull any food out of your diet, how do you bring it back in? So after you've avoided a food for a period of time, usually more than 4 weeks is long enough. But in your case, if you've been trying to follow the FODMAP diet for weeks and months, that's more than enough. I would suggest that you try to implement all the components of the Concussion Fix diet first, and then after you've implemented all those components, for at least, I'm going to say 4 weeks, actually 6 weeks would be perfect, would be ideal. Then you can start looking at introducing each one of those foods that you've been avoiding for one at a time after that 6 weeks. Now, I think that if you're deciding to use FODMAPs, I don't know if that's under the recommendation and the oversight of another healthcare provider, or you're just doing it on.
Yes, it is.
Yeah. Then maybe talk, if you are, then maybe talk to them about how they plan on reintroducing those foods. Because what I'm just thinking is that if you're doing some sort of protocol in order to kind of rebalance your microbiome, there might be some additional components to, okay, we've avoided the FODMAPs, but now we actually need to weed out some of the bad bacteria that are present there. In that case, you may need to do a couple other steps before you reintroduce those foods. And so that would be something to talk to them about.
What kind of steps are you thinking about?
Well, for example, like, if there's a particular condition like IBS, we start looking at, okay, so why does a person have IBS? Is it food sensitivities? Is it, and there's testing that can be done for that. What I'm really thinking about is something called dysbiosis, or small intestinal bacterial overgrowth. This is a condition or a group of conditions that are basically an imbalance of too much bacteria, too many bacteria in the wrong spot. So what has to happen, and you need to either take antibiotics or herbal antimicrobials to eliminate those bacteria. And there's research showing that, like something like 30% of people with IBS have some sort of dysbiosis happening. There's a lot of overlap with this small intestinal bacterial overgrowth, or SIBO, SIBO. And you could also have fungal overgrowth as well. So these are things that require some testing, and then also some intervention to change the microbial environment. And then maybe your provider wants to add things in. So I'm not sure what their plan is.
Okay. Yeah, the thing is, I've been following this diet for years, so I'm not currently with a food specialist, but I have an appointment for next week too.
Okay.
And
Good
I
timing.
wanted to ask them to combine these diets, how to work that, and if I should reintroduce some stuff first or not. But I think you answered already that it's a good thing to first implement the whole thing and then try if I can do things back in. I have indeed the IBS, so I am curious if the dysbiosis is maybe also something to have a look at.
I'm glad you asked this question before your visit, because it's going to give you some specific talking points to speak to the provider about, like, is there any way we can test for there's this underlying issue behind IBS? Is there anything else that we should do before we start reintroducing these foods? Because if you've been avoiding them for years, that's quite a long time. That's more than enough for you now to give it a trial. And they may just say, just go ahead and give it a trial without doing any sort of work. But ask those pointed questions for them.
Yes, thank you. That's also why I wanted to ask it before I saw them. I thought maybe I have some more background in what to ask and what to notice. So thank you very much.
You're welcome. Thanks for your question.
We do get a lot of questions on reintroduction. I know when I did the elimination diet, they suggested picking one food and doing it over the course of a couple days. Yeah. Is that kind of what you recommend?
Yeah, exactly. So like if we went the food elimination reintroduction route, then you want to take one food and really in its purest form. Like let's say, for example, in your case, it would be eggs. So you've mentioned that before. If you wanted to challenge that again, then you would just basically have like scrambled eggs without anything else in it, not a compound food with multiple things. Like my wife made crepes for the kids, which had, dairy and eggs in it this morning. So that would be definitely one step. But just the point about FODMAPs, that's not a food sensitivity. That is an environmental, ecological, bacterial overgrowth that's causing the fermentation of these oligosaccharides. So that's the elimination and reintroduction works better for food sensitivities, but not as well for these classes of high oligosaccharide foods. So that's a bit different. That's where you have to kind of like readjust the environment before we start reintroducing.
Right.
All right.
Right. Here. My question is probably for you, Cameron. But I guess first a little bit of context. So I'm 34 years old. I work as a data scientist. My accident happened May 2023. I put my bike wheel in a streetcar rail and flipped forward face first into a car. Broke my nose and split my lip. And I guess my neck absorbed the shock. Luckily, no structural damage on MRI, so that's nice. However, I do have the following symptoms. Pressure headaches, trouble sleeping, especially without aids. I have this tightness in my throat, tightness in my neck. I have concentration issues, and I get this sudden episodes of retching / gagging when I walk or run. It's quite interesting that because I do a fair bit of snowboarding as well, and it doesn't present itself there. So nor does it do that when I'm cycling. And I've also tried getting my pulse up without like walking or running. So I've sort of ruled out the pulse thing already. And interestingly, when I push on my SEM muscle, I this instantly provokes this sort of retching. And this is a problem that's presented itself after I had COVID, which I find interesting. It just sort of came out of nowhere in November.
The retching specifically, are you talking about the retching?
Yes, the retching in particular, yes.
Okay.
That's the new one. All the other ones are sort of
that came on after you had COVID, but you had the concussion and neck injury in 2023. Correct.
So and I guess my primary sort of stressor in like the general symptoms is mainly screen. So it's mainly my job keeping me back. Like when I'm on holiday, I live a pretty normal life. So my question is this. So given the above, what sort of treatment options should I like look at for like sorting out this retching issue? Yeah.
Cam, do you want to take it?
Well, I mean, what do you think's going on in terms of the retching, Paul? Do you have any thoughts on that?
Well, yeah, I mean, like right away, just from what mentioned, I would say the fact that he can reproduce it by pushing on his SEM, that's like a pretty big giveaway that there's definitely some neck dysfunction.
Mm-hmm. But why would that cause retching? I'm just trying to think like anatomically or.
Well, like, okay, so gagging, retching, this is a very strong, the vagus nerve is very strongly involved in those two functions. So could there be some sort of input? Again, I don't see a direct kind of anatomical, physiological connection between the SCM but I mean, other than it's like pretty close to where the vagus nerve innervates, but vagus nerve is mainly internal, not so much external.
Right.
So he might just have this unique, I mean, I don't know, I guess unique anatomical connection between the two. So I would right away, just from like low hanging fruit wise, I would start with the vagus nerve rehab component, see if that makes any difference. Have you had any sort of manual care to that area that you've just told us that stimulates that retching?
No, I haven't. I have had visual treatment done, and because I did have like poor convergence with my eyes, and they were skipping around a little bit. But that's sort of mainly finished up, or it's finished up now. So my vision is quite normal now. But I haven't had any manual therapy. No.
Is it both sides?
Yeah, it's both sides. It's especially when I massage both sides, just underneath, behind the ears.
Behind the ears, eh?
Yeah.
So
Yeah.
up this way over here?
And
Correct. Yeah.
Yeah, I'm kind of having a thought too about, Dr. Cam, you talk about, self-massage and self-treatment can, generate different types of symptoms, right? Is it possible he's having like a sympathetic response to sort of poking around?
Yeah, I mean, that's my only theory. That's why I was asking Paul about if he thought of anything around the retching, because the only thing I could think of is some sort of sympathetic response or something, because, the neck is related to kind of this autonomic dysregulation as well. Like some people with neck instability will also have autonomic dysregulation as a result of that neck issue. Immediately I started thinking something with like recurrent laryngeal nerve, but again, that's more deep structure and it's not necessarily going to be innervated directly by the SCM, but it could be something where pushing on that causes that kind of, dysregulation and that sympathetic response. But then if he can exercise normally and get his heart rate up, it kind of leads me away from
The autonomic.
but maybe he's okay with exercise, but maybe it's a different pathway that I'm not aware of. Because people will get flare-ups with just manual therapy in general, right? And that can be an autonomic or sympathetic response. But yeah, I agree with Paul's suggestion and the fact that if you can push on your SCM and recreate that, getting some work to try and loosen that off may alleviate that symptom, right? It's going to be, when you get it done, it's probably going to bring it on quite a bit.
Mhm.
But as it works through and as things loosen up, you may be able to do other things without that response happening. So it's one of these kind of trial and error things. You just got to give it a shot and see if that helps. The fact that you can get your heart rate up with cycling or things where you're not bouncing up and down also kind of potentially points to something like that, where maybe there's neck involvement when you are bouncing up and down or doing like running, that tends to bring that on. And neck dysfunction is also related to some of those visual symptoms that you were experiencing. And so, especially if you are still having some visual symptoms, you don't feel quite right visually, but the optometrist or whoever has told you that your eyes are normal, but you still don't feel quite right, there's probably some neck component to it that's driving that continued feeling. So yeah, I would start with the manual therapy. What else have you done in the program? Like how far in are you?
Let's see. I'm working my way through the mindfulness stuff now.
Okay.
And
Yeah.
like
So there's
meditation stuff. Yeah.
Yeah. So there's once you kind of get to, once you kind of build that foundation, that'll likely help as well, because that'll help to bring down that sympathetic response, and it may assist with that sensation as well. But if I were you, I would try to get some good manual work. The problem is a lot of practitioners don't work on the SCM. Like you come in and they just work on the back of your neck, and they're really shy away because there's blood vessels in there. You got arteries and, your jugular vein, and you got your brachial plexus, which is all the nerves to your arm. And so practitioners get really uncomfortable about treating that area. Whereas I just dig in and go for it. I treat that on everybody. So you got to find someone who's willing to get in on the SCM, and work the SCM and the deep neck flexors as well, because those are closer to that one nerve I was talking about, which is the vagus, part of the branch of the vagus nerve, but it's a recurrent laryngeal nerve that actually kind of innervates the vocal cords in the throat. And so getting some work done on the deep neck flexors may free something up that helps with that response as well. So it's deep neck flexors, SCM. See if you can get somebody to kind of work on those with some manual care as you do all the other steps as well, to try and bring down that sympathetic response and see if that helps. Again, we're not really sure why it's happening. We're kind of just grasping here. We don't. I don't think we have.
Yeah. I'm just looking for the general direction. Luckily, I have. There's a clinic close by actually, which does their complete concussion care certified.
Okay, so where are you located?
I'm in Oslo.
Oh, perfect.
Norway.
Yeah. Okay. Yeah, we have some really good. Christian Hageson is. There's a few clinics in Oslo. Probably the most experience would be Christian.
All right. Do you know which clinic he
I'm gonna look.
at?
I'm gonna look right now for you.
Thank you.
While you're looking that up, Cam, one of the thoughts I was wondering we didn't really understand yet was when COVID occurred, how long ago was that? And when did the retching kind of begin? Did we cover that yet?
I think he said it after COVID this past fall.
Yeah, it was November, and the retching like started like a week after.
Okay. And then when did you start the program with us?
It was actually this was what inspired me to actually take the program.
Hey.
Yeah.
Yeah. So that started, then you began the program.
Yeah. However, having said that, I've always sort of had this. I always thought it was like a pulse issue before, so I've been like doing loads of running, and I've always felt a little queasy after that. But then I did some cycling, just like in a gym. Like one of those still standing bikes, and it very quickly occurred to me that I could push 190 without that being an issue. I didn't get any symptoms from doing that. So yeah.
This is all following your concussion?
Yes.
Yeah, to me, the fact that you can exercise to that degree, it sounds like an autonomic symptom, but yet you're able to exercise fully, which kind of goes against that idea. So, but it may just be autonomic dysregulation because of the neck alone. So exercise isn't bothering you, but once, when you're doing running or something, or maybe your neck tenses up, maybe that's putting some pressure on something that's causing that. So I wouldn't just do the foundational stuff, continue with the program, but I sent you 2 links here in the chat. You can see here, one of them is Nemus Storo. That's the one where Christian is. And then there's also another clinic called Apex. And they're also extremely experienced. They're very good with vestibular type stuff. They're mostly physios. And they have an osteo and a chiro as well. So that would be a good option too. So you might just try one of them and see if they're able to get to the root, and if not, you may try another one, right? Because when it comes to manual stuff, people have different hands, different styles, different, so it's a lot of trial and error. So, I would give it at least 6 sessions with one of them, and then if you're still not getting there, maybe try with the other one for a bit and see if that helps. That's the only thought I have, really.
I would definitely also incorporate the vagus nerve.
Yes, yeah, that too,
right?
That too.
So
yeah.
because I think, Cam, you're right that it's most likely some sort of sympathetic response. If it's not fully in a purely an anatomical response, that's not really a common connection that you get such a strong sympathetic, very specific. But the clue is that you can recreate it after pressing. So there definitely is some sort of anatomical stimulation there. And then also the fact that it came on after COVID. And so that tells us that there's an inflammatory component to it. Any sort of symptom that's worse after eating a particular food protein or after you're exposed to some sort of viral infection is a pretty strong indicator that there is some sort of neurological priming. And if you haven't got to that section yet in the course, you will. I definitely talk about it in my section, so you're almost there. Melinda talks about the importance of the vagus nerve. I definitely talk about the exercise side of things with the vagus nerve. So that tells us that there could be sometimes the vagus nerve is what's affected by the COVID virus, and that's why there's such variation between symptoms in this syndrome called long COVID syndrome. So again, just to kind of piece all this stuff together, I think all the components we are going to talking about in the concussion fix are applicable, and you may need to really double down on the manual and the vagus, and then also the anti-inflammatory stuff. So you're almost there, so keep going.
Yeah, thank you guys. That was a very thorough answer. Cheers.
You're welcome. Good luck. Keep us posted.
Yeah, we want to know.
Hey there. I guess I should say a little bit of background. I'm new to the Concussion Fix program. I started working through the courses. I think I'm almost halfway through. I live in Sacramento, California. Oh boy, I have a list of questions, but I know you can't answer them all right now. I guess one question I have for Dr. Cam is the exercise heart rate band. I know you mentioned that it's good to have one for the chest, but I do have an Apple Watch. Is that okay? Or would you recommend purchasing?
No, Apple Watch is fine.
Okay, and then the manual therapy. Right now, I'm currently doing upper cervical chiropractor close by where I live. I don't get adjusted every time. He says that basically he's not going to adjust me if things are working and my body's healing itself. And I'm just wondering, is that normal? And also mention not to do any type of massage on the upper neck at the same time. And I'm just wondering if I should listen or if I should do manual therapy because I kind of have the same thing, like on my neck, it's sore whenever it's kind of touched or rubbed. And yeah, I guess I'm just trying to see what I should do about that. Also, I'm originally from Ontario. I moved here to Sacramento, but I guess I'm going home in a few weeks. So if you have anyone over there that you would recommend, in the, I guess, Hamilton, Mississauga area, that's where I'll be. So I'm also open to finding someone there too.
So, I mean, the big issue I generally have with like just the upper cervical chiros is that they focus purely on adjustments and they don't do any of the soft tissue stuff, which is like probably the most important. Like when I see patients, it's more the opposite where it's like I only adjust them, sometimes if there's like something that's like really kind of driving things. Whereas with the soft tissue, it's like a couple minutes of soft tissue work will really clear things up right away. So some people, they swear by upper cervical chiro, but that's generally the people that do really well are the people that only have that issue, right? So if you only have an issue with the upper cervical, then maybe getting upper cervical treatment will be like, whoa, that really helped me. But I feel that's only about 10% of patients, right? Like the other day I was working on a guy and when I pushed on his rhomboids, which are in the between his shoulder blades, that's what recreated his headache. So if he's getting upper cervical work, they're missing the fact that his headache is actually coming from way down here between his shoulder blades, right? So when you stay very, very local, and then not only that, but it's like you can find issues in the hips and pelvis that are causing all these biomechanical alterations that's actually driving the reason why the neck is dysfunctional. So it's just a difference in like theoretical framework. Their philosophy or their idea is that everything is from the upper cervical. If you fix the upper cervical, it fixes everything else below, right? But I find that hard to believe because I would think that starting from the bottom up is going to fix things up the chain, right? Because if your legs are different lengths, for example, because your pelvis is torqued, well, your lumbar spine is going to curve, and then you're going to try and you're going to do anything you can to keep your shoulders and your head level. So if you have this leg length difference, what's going to happen is you're going to tilt to try and compensate for that leg length difference to try and keep your center of gravity in the middle. So adjusting the upper neck isn't going to fix the pelvis below it. It's more the opposite, where fixing the pelvis below it is going to help things up the chain. That's just a difference in philosophy. So I personally think that soft tissue is probably more important than the adjustments, but the adjustments are important as well. And so, I mean, I don't want to go against what your provider's telling you, and that's not what I'm telling you to do, but just, consider that soft tissue is a big issue. And if they're not working on it, you may not be in the right spot. The other thing to consider is, are you seeing major improvements with this treatment?
Um, I don't know. I think it's hard to tell. I've only had one adjustment so
Okay.
far. But I did have massages beforehand because I thought that it was more of a muscular thing. It would help in the short term, but then maybe after 2 days, I feel like everything would just come back. And I guess things were getting costly. And I was thinking, you know what? If it's not helping, then I should just stop. But I'm not sure if that was the right
But
mentality.
again, like massage is generally going to focus on the back of the neck. They're not going to work on other structures in the front for the most part. And it's usually static, like rubbing the muscles, but a lot of times the muscles are kind of stuck to the ones below it. So you have to kind of do it with movement. Go and watch. I did 2 seminars, Manual Therapy 1 and Manual Therapy 2 in my resources. Go and watch those and you'll see kind of like how things should be treated or how at least I approach my treatment. And then you can see, okay, is this what I'm getting or not? Because people will say that, be like, oh, I've tried chiro. Okay, that means you've tried one chiro. Different chiros are going to have different, skill sets, different hands, different approaches. So it's trying to find the one that's actually going to do kind of what you need. So I tried to give some examples. I have a video there of me kind of treating somebody so you can see exactly how I do it. And it doesn't necessarily mean that that's the only way to do it, but you just kind of get an idea of what should be included.
Okay. Thank you so much.
Yeah. When are you coming back to Ontario?
Still don't know the date, but I think in 3 weeks, probably, beginning of March.
Okay. Yeah, I mean, we have clinics all over here. Would you prefer Hamilton or?
Wherever. Where I would be open wherever.
I mean, we have a good one in Burlington. We have some good ones in like Stony Creek area. So how about you send me a message in the platform, and I can try to link you up with somebody.
Perfect. Thank you so much.
You're welcome.
I appreciate it. Do I have time to ask Dr. Hrkal a quick question?
Go for it.
Okay. So I'm taking some vitamins and I'm just wondering, is it possible to take too many at the same time? And I know that you said that it's really hard for that you haven't seen much success with vegans through the course, but I am vegan and I'm not really open to compromising, I guess that. And so I was wondering, is there anything that I can do to, I guess, have the best chance of success being a vegan?
Yes, absolutely.
Okay.
Again, I want to make sure we're clear about that. Is that I'm basing that on my clinical experience, and again, that's if you have an ethical or moral issue, absolutely feel free to do it. So here's the challenge with being vegetarian and specifically vegan. Number one, it's a lot harder to get protein that's bioavailable. It means that that protein is broken down in amino acids, and then that gets incorporated into your muscles. But here's the thing: your brain also uses those amino acids to produce inflammatory cells, neurotransmitters, and a lot of the key building blocks to repair not just brain tissue, but also muscle tissue. And we've just talked about how important the neck is. So that's number one. So number two, there's a lot of trace elements and minerals that are just really hard to find in plant-based sources. So the main ones are zinc, and then iron will be the second ones. And so iron, you can find it in non-animal based sources. However, it's not very absorbable. And this is the big thing that I find when we're having these kind of like discussions online. It's like, oh, you can find iron in dried apricots and spinach. The problem is it's present there, but it's in forms that's so hard for the body to get out, because all the fiber that comes with those those foods that are higher in those minerals, they are going to bind up all the minerals and not allow them to be absorbed. So that's another issue. So far we have protein, then we have specifically zinc, which is mainly only found in animal foods, and then we have iron, and then you have the vitamins. So fat-soluble vitamins like vitamin A, really the only natural source that you can find is in organ meats, and then vitamin K is mainly found in things like butter. Grass-fed butter is going to be higher in vitamin K. So those are fat-soluble vitamins. So you can supplement with all the things that I've shared so far here. But you have to be a lot more on top of it. There's a couple other ones. Then there's B vitamins, and the B vitamin family, again, it is found in small amounts. Certain ones like folic acid is found in specifically vegetables and a couple of fruits like strawberries. But B12 is not found, and it's difficult to find it outside of the animal world. And again, meats and organ meats are going to be the richest sources of B12. And then finally, and probably one of the most important ones when it comes to brain health, is creatine. Creatine now has really enjoyed a resurgence of online attention, where some new research has come out in the last couple of years showing that especially women, as they age, they are going to have decreased levels of creatine, and it has a lot to do not just with muscle formation, which is what it's been studied for the last 3 decades, which is like, creatine, that's like for that person that's like weightlifting in the gym and trying to put on muscle mass. That was the old indications, but the new indications are it's really helpful for brain function. So that's one of those things. If you're not eating any sort of animal meat, which is the place where you're going to get creatine levels, then you're definitely going to have to supplement. So just as a review, B vitamins, the key minerals, so like iron and zinc are really important. So iron specifically is one that you really want to emphasize. Creatine, fat-soluble vitamins, and then in the family of fat-soluble vitamins, there's omega-3s. And omega-3s, you have to find really the most bioavailable sources in fish, and there is some algae sources, but again, it's a lot lower, and you have to dose pretty high to get that. So if you cover those 5 kind of bases, then you can offset the kind of disadvantages of being vegan. Does that make sense?
Yes. So fat soluble vitamins, iron, B vitamins, and creatine.
Yeah.
Okay.
And then omega-3s as well, and then obviously protein. I started the conversation off with protein, and I should mention that's a pretty big emphasis. So that means that maybe you need to do like a scoop of plant-based protein to kind of up your levels. I find, because I work a lot with people that are trying to optimize their body composition over and above brain health, and it's probably the biggest thing that people don't get enough of. And it's a calculation based on your body mass. So you want to ultimately get, in order to kind of maintain your muscle mass, if you want to build muscle, like hopefully everybody does that's listening to this, then you actually want to get above what your basic needs are. And you're somewhere in the neighborhood of about 1.5 grams of protein per kilogram of your weight. So that's a quick little calculation. So convert your pounds into kilograms and then multiply that by 1.5. And that is how you find your ideal protein intake daily level. And what you'll realize is that for most people, it's somewhere between 80 to 100 grams of protein a day, which if you just break it down, that means it's 30 grams of protein per meal. And something like an egg and yogurt, if you're vegan, you're not doing that, you're going to get maybe 10 grams of protein. So right away, it's a huge obstacle if you're not supplementing, especially if you're 100% vegan and plant-based.
Perfect. And then is it possible to take these supplements too much at the same time, or can I take them all in the morning?
Yeah, that's a great question. So I'd suggest that you try to divide them up as much as possible, especially minerals. You don't want to take them all together because eventually they do compete with each other. B vitamins can all be taken together. Fat-soluble vitamins and omega-3s can all be taken together. And so those are fine. So I think most people, just from a compliance perspective, there's like a morning dose that you can bring all this stuff in. And then there's an evening dose, and maybe just break out the iron and then the creatine by itself in order for it to be optimally absorbed.
Okay. Thank you so much.
You're welcome. That's a great question.
So I have a question on my neck, because I'm trying to figure out whether the symptoms I'm getting show up in the neck or whether they come from the neck. So every time I get symptoms, I get a corresponding experience in my neck, especially I think it's the suboccipitals, but also in the front. I think it would be the SEM, but I'm not sure. It's just somewhere in the front. And it's especially provoked by doing things with my eyes, such as reading and screen work and stuff like that. But I've been to my osteopath quite a lot, and he says my neck looks good. And when I leave, I get symptomatic for 2 or 3 days, which you say, Cam, is supposed to be good, but it doesn't really change anything long term. I do, however, experience that I can sort of increase my workload over time, so I do progress. So I'm just wondering whether these symptoms are something that will go away with time, or whether I should have manual in order to sort of remove that obstacle so I can, read better.
So remember, whenever your eyes move, it engages your neck muscles. That's just kind of the feedback loop that's there, right? So we are basically set up that if something is moving over in our peripheral vision, we can look and turn our head in the same direction. So anytime your eyes go this way, all the muscles engage that turn your head that way. When your eyes go this way, same thing. So when you're working on the screen and you're scrolling and your eyes are going up and down and side to side on the screen, or you're reading and you're going back and forth across a page, your eyes are constantly moving back and forth. And so your neck is engaging back and forth. And if you have dysfunction there, you'll start to either experience neck pain, or what a lot of people will experience is a headache. And they will assume that this is related to their eyes. They'll say it's strain, it's eye strain. And it may be, but what's more common is that it's actually just triggering your neck muscles to fire repeatedly. And if they're dysfunctional, it's going to start to cause pain. But people might experience that either as pain in the neck, or they might experience a referred pain into the head. So their headache is actually coming from their neck, not from their eyes. But it's the eye movement that triggers the neck to get tight and stiff if your neck is dysfunctional. So you're going to an osteopath. Yes, it's common that your symptoms will flare up after a treatment, but it's usually only the first, 1 or 2 treatments that this happens. If they're getting to the right spots, generally you shouldn't have any increased symptoms after treatment after maybe the 3rd or 4th one. And then you should actually experience relief from that. So if you're going there and every time you're feeling flared up and it's not really doing anything in terms of progressing you, then you're likely just seeing the wrong provider. So you might need to find a different provider. Again, I would encourage you to watch the Manual Therapy 1 and 2.
I have.
Okay. And is that what your osteopath is doing?
It kind of looks like that, yeah. He's doing sort of work in the pecs, and then he's doing especially soft tissue in the back. I'm not sure exactly what. And then he's been doing some dry needling and some adjustments. He's not doing the electro thing, and I'm not I don't remember exactly, but I don't remember him working a lot on the front of the neck.
Right.
So that's the only
Those are the
thing
big ones.
Yeah.
Right. The suboccipitals are usually tight because there's some other dysfunction. When the SCMs are tight, it pulls everything forward and that jams up the suboccipitals. So I can work on the suboccipitals and maybe give you a little bit of temporary relief. But if I don't work on the SCMs, my main problem is still there. So I'm not going to get the suboccipitals are just going to tighten right back up again, because the reason they're tight is not just because they're tight. They're tight for some other reason. Right. So the pecs is great. But if he's not working SCM and not working deep neck flexors, the neck is going to stay forward like this. And that's going to continue to jam these up. Another thing I find with tight suboccipitals is people usually have a TMJ problem. So their jaw. So I've started on every single one of my patients now, I've started going inside their mouth and working on a muscle called the pterygoid, which is kind of up into the back inside the mouth, and releasing that. And that just relaxes the suboccipitals, right away. So if you're not finding good results with this provider, then I would try to find a different provider.
Okay. So it's not something that I have to work my way out of through screen work. It's actually something that I should seek out good manual care for.
Yeah, I would say, because the neck, you have some, to me, it sounds like what's happening is you have neck dysfunction. You go and use the screens, your eyes are moving, it's triggering the muscles to engage. And because they're dysfunctional, it's going to cause these symptoms to come back. So unless you get that kind of neck straightened away, then screens are going to be a continuous challenge for you. And it's not something you can just kind of like work your way out of necessarily.
Okay.
Yeah.
That makes sense.
Where are you located?
Oh, I'm in Copenhagen, so the nearest clinic you have is like 4 hours away, so that's pretty rough.
It doesn't have to be one of our clinics, but if you can find somebody who, if you go on their website and they're, maybe a chiro or something like that, and they specialize in like the treatment of headaches. Like if you look at their website and it says they treat headaches, they're probably generally pretty good with necks.
Yeah.
And like
I did find someone with I haven't met him yet, but I looked at somebody doing ART, and you said something about necks and headaches and stuff. So I was kind of looking for those things, but I just wanted to ask one of you guys first whether you thought it was the chicken or the egg with the neck and the eyes.
Yeah, I don't know which one's the chicken or the egg, but it's
I don't know.
It sounds like it's a neck issue.
Okay.
Yeah.
Okay. Thank you. Can I ask Hrkal a question real quick?
Sure.
So I actually posted both these questions. You can just ignore them, but it's because I've been dealing with IBS, and it's never something I was formally diagnosed with. I was just being checked for it, and there was nothing else wrong. So you get this sort of little paper telling you can do FODMAP and stuff, and I've been doing that over the years, and so has my mom. And I've been doing the Concussion Fix diet for at least 6 months now, and I like it a lot, but it's not that my stomach is just zero problems. I still get constipation from time to time, and I still feel it sort of vibrating my bowel. So I was just wondering, is this a hindrance towards my recovery? Something I should try to figure out like 100%, or I mean, because I can live with it, and I'm actually doing pretty well just living and eating the way I do. So how big of a problem would it be, do you think?
Well, I think that if you've been noticing improvements, the question of like the residual effects that you still have, the residual symptoms that you have, is it a problem for your concussion recovery? I think probably the probability of that is low now. I think that now the residual effects most likely are still to do with some sort of very personalized either microbiome imbalance issue or some sort of sensitivity that you have. It's not a necessary. I mean, I don't know if you've tried the whole FODMAP piece, which we had a conversation about earlier today, but I think food sensitivities would probably be the first place to start to see if there's anything else that is healthy and even possibly on the concussion fix diet list. That's okay. But then it's very personalized. Like for me, it's eggs and dairy, and both of those are not something that we say you have to avoid. They're both sources of protein, but that's a very personalized thing to me. And so you might have that same personalization to figure out the rest of the GI symptoms. Could that take you to the next level for concussion recovery? Maybe. I don't know. It's worth an exploration, but I think after you've really done the core of the diet, if you've done it for this long, you've probably already achieved most of the benefit that I think diet is going to give you, but it also depends on how much more symptoms you have left. It sounds like neck is a big priority here for you, so I'd make that make that your number one focus, and then if you can find some food sensitivity testing, that could be maybe a good next step.
And I just wanted to jump in there around, we've talked about IBS a couple times in the last hour about the connection between stress and IBS and stress and digestive troubles. So it could be something to just check in with yourself. Hey, is there any stressors? Do I feel like I've been experiencing anxiety, or is there a lot of change? These are some of the things I talk about with my clients, then come to see me and talk about a lot about digestive issues. Is often there's this huge link to stress or life changes, or experiencing pain, like your symptoms you might be having with PCS. So these are all important things just to kind of ask yourself, is stress a component of this as well? Sometimes people will actually experience a resolve of their IBS without having to change their diet. In my experience, I don't know if you would echo the same, Dr. Paul, when stress resolves. So just something to keep in mind.
Yeah, stress is a huge component, probably. And I mean, it's one of those things that everyone kind of just like attributes a lot of stuff to, but then when you actually look at the data, the evidence, and the physiology, it actually has a lot of these effects that people do say. And so again, if there's a really strong stress component and you've done a lot of the dietary changes, whether it's FODMAPs, whether it's food sensitivities, whether it's following the Concussion Fix diet, and you're still getting gut issues, but that stressor is still there, whatever it might be, the symptoms, not working, all the stuff that we all deal with, then you can still be getting those symptoms from that psychological side of things rather than just an actual physiological side. I see it I'm so glad you mentioned this, Melinda, because I see it over and over that people will have an amplification of any sort of reaction if they're in a state that is overstimulated, nervous system overstimulated, autonomic dysfunction, and also anxiety and all the physiological kind of like patterns that accompany that. So good point, Melinda.
Yeah, and it even goes beyond that, right? Depression or any kind of, disruption in your life. Like there's so many psychological and emotional considerations when it comes to stomach problems and digestive issues. So just not something to be overlooked, because sometimes you can say, hey, I need to overhaul my diet, or I need to, start antibiotics for certain types of bacterial overgrowth. That may be the case, but sometimes the first thing to look at is, well, what's been happening? Well, you're here because there's been a concussion. Concussion disrupts that HPA axis, if I'm correct, Paul. And then you get a lot of this disruption in your digestion. So this is why we kind of place the recovery mindset module first. Can we regulate our nervous system, learn ways to sort of calm down that sympathetic response, which is sort of like a baseline for everyone when you're experiencing persistent concussion symptoms, is likely to have this sort of baseline of stress, this baseline of sympathetic activation. So our nervous system is on overdrive. And then likely you might experience resurgence of flares like IBS. So it's a common story for us. We often hear, well, my IBS was fine for years and years and years. Then I had this concussion. I've been suffering with these persistent symptoms. Now my IBS is back. Okay, well, that makes sense, right? You've had a disruption in the systems in your body, and it can kind of flare up old issues or issues that tend to flare when there's life changes. So going back to that foundation, if you've already gone through the recovery mindset module and you find that, hey, I actually do feel really grounded, I do feel regulated, then move on to things like, is it possible there's, things like SIBO or the bacterial overgrowth that Dr. Paul mentioned, or is it possible that we need to modify diet, versus kind of jumping to those things before looking at the possibility of having that sort of nervous system disruption or that accumulation of stress or life transitions.
Okay, that makes sense.
Okay, so at this point, we're going to flip it back to Nikki, and she's going to work us through a couple of the chat questions.
All right, first question. I was reading yesterday a general recommendation, not for concussion, that when you go walking, it is more beneficial for fitness to alternate periods of brisk walking with slower walking, sort of a HIIT approach. I have no problem walking briskly for half an hour, but I'm wondering if this approach might be more beneficial.
From a concussion perspective, the research is all just on steady state. So what you want to do, as long as you're not going above your top end threshold, then that's fine. But generally, like, this isn't, doing HIIT exercises is great for health, but it's not necessarily what you want for concussion recovery. So I would focus more on where the research is from the concussion recovery standpoint, which right now is all based on steady state sub-symptom threshold exercise for 20 to 30 minutes per day. So once you establish what your threshold is, you work slightly below that for 20 to 30 minutes, do that for a couple weeks, and then you try to increase the threshold, see where the new threshold is, and then work below that for 2 to 3 weeks. So I would say stick with the steady state for now.
Yeah, I just heard this from a patient as well, Cam, where they were like, "Oh, can I do HIIT training?" And HIIT training is great if you have an intact, highly functional autonomic nervous system, because it is going to challenge you on the muscular but also neurological front. Anything higher intensity and changing intensities rapidly, you're going to have more of a challenge autonomically. But the steady state is you're trying to build that capacity in the autonomic state. So I agree with you, Cam, that the steady state for 95% of post-concussion patients is going to be the best thing. And then I think in general, after you've fully recovered or recovered as far as you can get, then you can start incorporating some HIIT.
Yeah, like same thing with weight training, right? People ask about weight training, and because you're going to have these fluctuations in your heart rate, it kind of mimics a bit of HIIT training, where it's like you do a set, your heart rate spikes, and then you kind of relax for a few minutes, your heart rate comes down. So that's going to be more challenging for the autonomic nervous system to deal with. So usually what I say is get yourself up to a point where you don't have a threshold. You could exercise 20 minutes, with no issue at, a high 80% of your max heart rate or 75% of your max heart rate with no issues. Then you're ready to now start doing HIIT, because you've basically proven that your autonomic nervous system is well balanced, and now you can start doing, more intense physical activity if you want.
Mm-hmm.
Great. Next question here is, I can't seem to get past the recovery mindset section. Any idea on how to help me get through this?
Okay, maybe we could get a little more specific, see if the member might expand a little bit in the chat for us. What part of the recovery mindset is it? The whole thing? Maybe there's one specific section where you're getting hung up on. So maybe we'll give the member a chance to respond there, and then we'll loop back.
Yeah. All right. So the next one. Are there any homeopathic remedies that can help with headaches? They have gotten better while going through the program, still trying to pinpoint the reason. I don't think it's neck related, but more weather hormone related. I take arnica for other issues, but I didn't notice a big difference for the headaches.
Yeah, again, I want some clarification. Why are we saying that it's not neck and it's related to weather and hormones?
This is the challenging part.
Yeah. Okay. So, in general, listen, there are some homeopathic remedies like arnica that have been actually studied, despite the fact that it's really difficult to study homeopathic medicine because of the actual potency and the dilution of the actual remedies themselves. When you start getting into homeopathy, it's extremely personalized. So this is just a general comment. What do I mean by that? As a naturopathic doctor, I have training in homeopathy, and full disclosure, I don't practice it very much because it's almost like a subspecialty in its own. And there are actual homeopaths that this is what they've dedicated their life work to do. So if they want to come up with a personalized remedy for you, this means like they're actually matching your symptoms to that remedy. Arnica is unique because it is meant for any sort of acute trauma, especially when a person has that feeling of like, I'm in shock and I feel bruised. So those are some very specific connections. Those descriptors are really important. Headaches, there could be so many different types of headaches. Is it an ice pick? Where is it? Is it like a rubber band pressing? Is it pulsing? Does it feel like a vibration, a bell? Like all these different characteristics will determine what remedy you could take. So there isn't, there are a number of general headache remedies for maybe the most common presentation, but there isn't just one or two or three remedies like there was in the botanical world where it's like, try magnesium, try CoQ10, try B2, try turmeric with that's highly bioavailable. These are like top 5 evidence-based things to do. The homeopathy doesn't so much work that way. It's extremely personalized, and so it's hard to give anybody those types of recommendations when it comes to traditional homeopathy.
Yeah, and I think and the member hasn't responded back, but I think, like, I know I've used homeopathy myself before, and I think people are just looking for that, what can replace Tylenol and Advil.
Yes, exactly.
I think that's what it comes down, like, yeah. That's how I'm almost kind of reading this, as to, I don't want to take Advil, Tylenol anymore, and I'm completely guessing on this, wanting to take something else. What can replace it is kind of how,
for sure,
it might be.
And hopefully my answer kind of gives people context that in botanical medicine you can kind of make some of these like replacements because of mechanisms that are similar. But in homeopathy, it's extremely personalized in terms of like what remedies would work for what person, and work with a homeopath to try to find. If you're really stuck on homeopathy, then work with somebody that's going to actually match your symptom presentation to the remedy.
Absolutely. Great. Another question here. I would like to know where I can get Iron Head 360 treatment for my weak neck. I'm not sure I should do it as my neck is still weak and tight. I'm working with a physiotherapist and chiropractor, but neck is still weak.
You'd probably have to go to, it's called Topspin 360, you're confusing two things, because there's one called Iron Neck. That's not what you want. You want the Topspin 360. I don't know if they have a list of providers, but I'm sure that if you go to the Topspin 360 website, you can contact them and try to ask if there are any providers in your area. And it's specifically for people with super weak necks. So you would be a good candidate, depending. But generally, that's what it's for. And it's good because it kind of meets you where you're at. If you're really weak and you don't have good coordination, well, then you won't be able to spin the device very quickly, which means it's not going to generate too much force. So it's self-guided, self-directed. So it meets you where you're at. And that's the beauty of it. And as you get more strength and more muscular coordination, you can spin it faster, which means it generates more force for you, which means you increase your strength even more. And then now you can spin it even faster, and so on and so on and so on. So it really allows you to build really well, and it's very safe, and the results are insane. So try to reach out to them and see if you can find somebody near you.
Great. So to loop back to the recovery mindset section, they haven't answered back, but I know while speaking with members, I do get this question often of this is a module that's really hard for members to go through. Some have never done mindfulness meditation before. Some have done just a little bit of it. So maybe, Melinda, if you could just kind of talk in general of maybe some tips on the best way to kind of go through that module for people who are new to it and have never really done a lot of internal reflection, mindfulness, meditation, anything like that.
Yeah. Well, the recovery mindset module covers a number of different areas. It first starts by helping us to build awareness about the interconnection between our thoughts, our mood, our behavior, our body sensations, as a way to just really start to understand how our mind and body are interconnected. So the first 4 sections are really giving us skills and tools to help us build this self-awareness about our mind and body, as well as taking a closer look at our thoughts and how cognitive distortions, which are, disruptions in our thought patterns, can actually help or hinder our healing. So, for example, something like catastrophizing, which is where we can look at the worst case scenarios for every possible symptom that we're experiencing. If that's something members are experiencing, it's likely this can actually hinder your healing because we're too focused on the worst case scenarios, which is going to disrupt our nervous system more, lead to things like anxiety, sometimes depression. So the first 4 or 5 sections are a review of those types of things. Then we move into certain types of practices. Once you've been able to build that self-awareness, and then take a look at the quality of your thoughts, we then move into different types of practices to help support your nervous system. Those include grounding, breath work, mindfulness, meditation, and self-compassion, which we're going to be even expanding further on our 2025 re-record that we're currently underway with. So it's kind of hard to answer here, but you might just think of the entire practices section as inviting you to explore which parts of the recovery mindset you might benefit from. So if you're feeling let me think of the best overall question, which is people start to get stuck on the mindfulness. So sometimes people will share with us, or oftentimes people will share with us, that I really like the grounding and the breath work, which is sort of nervous system regulating. But when I get to mindfulness, I start to feel a little overwhelmed or triggered. So it's sort of this sense of assessing for yourself if a certain section or practice in the recovery mindset feels like it's too much. You just want to slow down and work on the pieces that resonate with you right now. And we invite those questions here. So even getting a little bit more specific for us will be helpful. Some people do not like the practice of meditation. So there is a module there where you'll be walked through how to meditate from start to finish. And that may or may not resonate, right? So there's also different offerings there, like movement practices. We have lives on somatic work, how that's also regulating for the nervous system and supports our focus and concentration in the same way that meditation can. And then self-compassion can be a challenging one for a lot of people because it invites us to take a real critical look at how we talk to ourselves and speak to ourselves. So sometimes we can be quite self-critical and hard on ourselves following a concussion, especially when symptoms persist. So the self-compassion module talks a lot about how we can start to generate feelings of softness and kindness towards ourselves for our suffering. And sometimes people really have an aversion to that. And we even mention it in the module, right? It's natural to have an aversion if you were never raised as someone that was able to sort of think kindly and softly towards yourself when you're suffering. So the practices in the self-compassion module help us to support building a kind and supportive view of ourselves so that we can overcome challenging things like persistent concussion symptoms. So that's kind of an overview. There are hangups in different parts of the recovery mindset depending on the individual. So the more specific we can get with our questions, the more likely I'll be able to support.
No, I think that's great. Like I said, we do get a lot of members who, and we have it at the beginning for a reason, because it is such an important part. It does lay down the foundation, but it is one that some people do find hard as well to go through. So I think that was a great overview. And I would just add too, of like, don't, and I know easier said than done. Don't stress about it. There's no rush. There's no, right. We always say go at a turtle pace, because it takes time. And that includes, the whole program of just take your time and go through it, and don't rush, and kind of enjoy the process in a way. I know we want to get better yesterday, but it's the slow and steady process through it that's going to make the best results.
And the kind of idea of this growth mindset that we review at the very start of the program is this sense of inviting yourself to get curious about certain ways we look at ourselves or look at the world that might hold us back. And that's often what shows up in that recovery mindset, is certain assumptions or ways we view the world that we feel are static or fixed. We just might not notice that they're static or fixed until we actually look at them a little bit closer. And then we're like, oh, right, I never learned how to be kind to myself growing up. So I don't know what that's like. I don't understand why I can't go through the self-compassion module. But when we take a little bit of a closer look and put a closer lens on, it's, I actually never learned that being kind to myself can actually support recovery, can support changes in our mind body. So there's a lot of examples like that I hear.
Great. That is great. I think that's a great spot to wrap it up for today also. So again, thanks everyone.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.